My name is Taryn Vian. I'm professor and the director of community and public health practice and acting director of the health policy leadership concentration. This summer I taught global perspectives in public health, and I also teach leadership and collaboration. I think this group of students really has passion for public health, and they dedicated themselves really to the tasks that we include in the courses. Especially, we design these courses to build competencies that students will really need in the field, so they're very practical assignments. I think that always conveying information in a passionate and persuasive way is critical to inform others of public health messaging and important steps we can do to improve population health. And the students have had a chance to master many types of communication, including written communication, but also presentations and infographics. This semester I had a student who wrote a paper about the influence of climate change on pregnancy and fetal and neonate outcomes. And I really myself became much more aware through reading and providing feedback on that paper of how important this topic is, and even all of the different things we need to do to prepare for climate change, especially in global climates and resource constrained areas where people don't have access to air conditioning, and yet these are really negative outcomes that can happen for the infants. Students choose topics based on their own interest and you modify them over time as they find research, but they really pick topics that are so important for the health of populations: reproductive health, aging, use of digital technology in certain countries and how that can influence health outcomes. But they never forget the constraints that we face in implementing public health policy, identifying stakeholders who can support your initiatives, how to communicate with the stakeholders to really get the funding and the support on the ground, and then how to communicate with populations themselves, the people who are at risk, and to help them become aware of actions they can take, their communities can take to really prevent problem. I think over time students become less focused on what the assignment is asking for, what the directions are, and they really start to realize that there won't be particular directions when you're a master's degree student, that you get to decide when your research is done, when you have enough evidence, what's the next problem that you need to start addressing. So I think they learned initiative, they learned to work in teams and collaborate closely with others, because we're not in this alone. It's a team sport, public health, and you really need to get your partners to appreciate the challenges in front of them and to recognize their own strengths and really to put those to work at continuing to work at a solution to a problem. And I think they learn that initiative and that those best practices of collaborative leadership. I love to hear from our graduates afterward. I love to follow their careers, to really learn how they've put in practice some of the concepts they've learned, but more how they continue to learn, because really everything we taught people is to learn how to learn, to realize that the knowledge is constantly changing, but that our duty as public health professionals is to use the best evidence to understand the needs and to address those needs cross-sectorally. And I love to bring experiences of our students into the classroom, so I hope our graduates will keep in touch.